Nurses want to care for patients, but too much of their time is spent on charting and other non-patient facing tasks. What's worse, charting is often error-ridden, hurting patient safety and compliance. Well, before we begin, I'd like to take a moment to thank our producer, Vincent. He always makes us sound smart and look good, and that's not easy. This month is all about gratitude, and along with Vincent, there's another person we don't get to thank enough, ourselves. It's sometimes hard to remind ourselves that we are trying our best to make sense of everything, and in this crazy world, that is not easy. Here's a reminder to send some thanks to the people in your life, including yourself. BetterHelp offers entirely online therapy that's designed to be convenient, flexible, and tailored to fit your schedule. Just fill out a brief questionnaire to get matched with a licensed therapist and switch therapists at any time for no additional charge. It's helpful for learning positive coping skills and how to set boundaries. It empowers you to be the best version of yourself. So whether you're dealing with stress, anxiety, or just seeking personal growth, BetterHelp connects you with licensed therapists who can support you on your mental health journey. Let the gratitude flow with BetterHelp. Visit betterhelp.com/CareTalk to get 10% off your first month. That's BetterHelp, HELP.com/CareTalk. Welcome to HealthBiz Briefs. I'm David Williams, president of Health Business Group, here with Hadassah Backman, CEO and founder of Guardoc Health. After a preventable medical tragedy struck her family, she channeled her nursing knowledge into software to stop it from happening to others. Welcome, Hadassah.
Thank you. Thank you for having me.
Why did you start Guardoc Health?
I felt that in terms of compliance regulation, we were always putting out fires, but we were never proactively getting to the root cause of the problem when it comes to nursing documentation. Primarily, we weren't addressing the fact that we put all of the weight of accurate documentation on the shoulders of a very stressed out, burnt out staff who have limited time and limited resources to create a clear patient profile. So this is the perfect storm for errors, and those errors, as you mentioned before, have catastrophic effects on both patient care and also organization reimbursement and financial health.
And what is the value proposition of your product? I understand there's a problem, but it doesn't necessarily mean people can afford to solve it or have a way to do it. So what's your value proposition?
So what we've successfully been able to prove thus far is that we're able to reduce the actual errors that the nurses are making because they become much more aware of what their individual pain points are. We can hone in on Nurse Susan keeps making a mistake on oxygen orders. And so then she can do education, and we're working on providing that education up against her particular pain point. And then we're also able to clearly show a reduction in wasted nursing hours. Today, administrative tasks takes many nurses away from the bedside, giving them prohibiting their ability to provide the patient care that they want to if they're a direct patient care provider, or forcing organizations to make a choice. Am I going to meet my regulatory and compliance requirements and take my nurse away from the bedside and have less patients? Or am I going to put my nurse at the bedside but not meet compliance and have more patients? And these are really the decisions that providers have to make today due to the shortage. So it's really, we're able to decrease wasted nursing hours. Additionally, we've thankfully already last month, we celebrated this, we can show an increase in value-based payment reimbursement. We've been able to show significant increase. We had a client who was only receiving only $15,000 for PDPM, which is performance-driven payment model billing, and we were able to drive that up a good 20% already. So we're good.
Very nice.
And then also reduce sluggish reimbursement and reduce rejections from CMS submissions.
Well, that's it for the latest HealthBiz Brief. If you like what you hear, check out my HealthBiz podcast for a full-length interview with Hadassah about her life and career. Hadassah Backman, founder and CEO of Guardoc Health, thanks for joining me today on HealthBiz Briefs.
Thanks for having me.